Good morning, everyone. We have some truly sobering news to share today. A new wave of concern is sweeping across the nation. It's about something many of us might have in our homes or enjoy socially. We're talking about alcohol. Recent reports are painting a stark picture, revealing a shocking rise in cancer deaths directly linked to alcohol consumption right here in the United States. This isn't just a small uptick. It's a significant surge that has health experts deeply worried and calling for urgent attention. The numbers are compelling, and they tell a story we all need to hear, understand, and discuss openly. This isn't a topic that's easy to talk about, I know. Alcohol is often associated with celebrations, relaxation, and social gatherings. However, the data emerging forces us to confront a more dangerous side. The idea that something so commonplace could be contributing to such a devastating illness on a larger scale is alarming. It challenges our perceptions and perhaps our habits. It's a reality check that demands our attention, not to create fear, but to empower us with knowledge. We need to understand what's happening so we can make informed decisions for ourselves and our loved ones. This is a public health issue that touches many lives. Over the next few moments, we're going to delve into this serious issue. We'll explore how alcohol consumption is connected to various types of cancer. We'll look at the scientific explanations in simple, understandable terms. There's a lot of information out there, and our goal is to bring you clarity. We want to break down the complexities and present the facts as they are being reported by leading health organizations and recent studies. This isn't about judgment. It's about awareness and providing you with the information you need to stay healthy and safe. We will also examine the latest statistics. What do the numbers actually say about this increase? Who is most affected by this rising trend? And importantly, what are medical professionals advising? There are steps we can take to mitigate these risks, and understanding them is crucial. This is a conversation that needs to happen in our homes, in our communities, and on a national level. So stay with us as we explore this concerning development and what it means for all of us here in the U.S. So, how exactly does alcohol contribute to cancer? It's a question many are asking. When we drink alcohol, our bodies metabolize it into a chemical called acetaldehyde. This substance is a known carcinogen, which means it can damage our DNA. Think of DNA as the instruction manual for our cells. When it's damaged, cells can start to grow and divide uncontrollably, and that's how cancer can begin. This process might not happen overnight, but consistent exposure to acetaldehyde, even from moderate drinking, can increase the risk over time. It's a chemical process with very real biological consequences. Furthermore, alcohol can also impair the body's ability to absorb essential nutrients, like folate and other vitamins. These nutrients play a vital role in maintaining healthy DNA and cell function. When their absorption is hindered, our cells become more vulnerable to damage and cancerous changes. Alcohol can also increase levels of certain hormones, such as estrogen. Higher estrogen levels have been linked to an increased risk of breast cancer. So, it's not just one pathway. Alcohol can affect the body in multiple ways that collectively raise cancer risk, making it a complex adversary for our health. The types of cancer linked to alcohol consumption are quite specific and often involve the parts of the body that come into direct contact with alcohol. These include cancers of the mouth, pharynx, larynx, and esophagus. The liver is also significantly at risk, as it's the primary organ responsible for processing alcohol, leading to liver cancer. Beyond these, alcohol consumption is also a recognized risk factor for colorectal cancer in both men and women, and, as mentioned, breast cancer in women. It's a wide range of serious conditions, unfortunately. It's critical to understand that there isn't really a safe level of alcohol consumption when it comes to cancer risk. While heavier drinking carries a higher risk, even moderate or light drinking has been shown to contribute to an increased likelihood of developing certain cancers. This is a key message from health organizations worldwide. The more alcohol a person drinks regularly over time, the higher their risk of developing an alcohol-associated cancer. This cumulative effect is something we all need to be aware of as we consider our habits. Recent national reports, including analyses highlighted by sources like Yahoo News and major health journals, are sounding the alarm. These studies indicate a clear and troubling upward trend in cancer deaths attributable to alcohol. We're seeing figures that suggest tens of thousands of new cancer cases, and tragically, a significant number of deaths each year in the U.S. are directly linked to alcohol use. For instance, some reports estimate that alcohol contributes to roughly 6% of all cancer cases and over 4% of all cancer deaths in the country. These percentages represent many lives impacted. The data often points to a particularly concerning rise in certain demographics and for specific cancer types. For example, there's growing concern about increased rates of alcohol-related cancers among younger adults than previously seen, suggesting changing patterns of alcohol consumption might be playing a role. Liver cancer and esophageal cancer rates linked to alcohol have been particularly highlighted in some analyses. The consistency of these findings across multiple studies from reputable institutions adds weight to the urgency of addressing this public health challenge. These aren't isolated incidents, they form a pattern. So why are these numbers going up? Experts suggest several contributing factors. There may have been shifts in drinking patterns, potentially including increases in binge drinking or overall alcohol consumption in certain populations over the past couple of decades. The pandemic may have also exacerbated some of these trends, with reports of increased alcohol sales and consumption as people coped with stress and isolation. Additionally, there's a possibility that increased awareness and better reporting methods are capturing a more accurate picture of alcohol's true toll than in previous years, making the problem more visible. Identifying who is most at risk is complex, but generally the risk increases with the amount of alcohol consumed and the duration of regular drinking. Individuals with a long history of heavy drinking face the highest risks. However, as we've discussed, even moderate drinkers are not entirely without risk. Genetic factors can also play a role, making some individuals more susceptible to alcohol's damaging effects. It's also important to note that when alcohol use is combined with other risk factors, like smoking, the cancer risk can be amplified significantly, creating an even more dangerous situation for one's health. Medical experts and public health officials are urging a renewed focus on education and prevention. They emphasize that alcohol is a modifiable risk factor for cancer, meaning it's something individuals have some control over. The primary advice is straightforward. To reduce your risk of alcohol-related cancers, the best approach is to drink less alcohol. For those who don't drink, experts advise not to start for any perceived health benefits. Organizations like the American Cancer Society and the World Health Organization provide clear guidelines, generally suggesting no more than 1 drink per day for women and no more than 2 drinks per day for men, if one chooses to drink at all. Beyond individual choices, there's a growing call for broader public health initiatives. These could include more prominent warning labels on alcoholic beverages, similar to those on tobacco products, clearly stating the cancer risks. Increased funding for public awareness campaigns that educate people about the link between alcohol and cancer is also seen as crucial. Some experts also propose policy measures such as regulating alcohol availability and pricing, which have been shown in some contexts to reduce overall consumption and related harms. The goal is to create an environment that supports healthier choices for everyone. The impact of these findings is far-reaching. It challenges a deeply ingrained societal acceptance of alcohol and forces a conversation about its true costs, not just in terms of addiction or accidents, but also long-term health consequences like cancer. This new data reinforces the message that there's no completely risk-free level of alcohol consumption when it comes to cancer. It's a stark reminder that everyday choices can have significant impacts on our long-term well-being. This knowledge empowers us to reevaluate our habits and make informed decisions for a healthier future. We encourage you to reflect on this information. What are your thoughts on these findings? Do these reports change how you view alcohol consumption? We invite you to share your perspectives and experiences in the comments section below. Your insights are valuable as we all try to understand this complex issue. Please consider liking this article if you found it informative and subscribe for more updates on important health news. Thank you for taking the time to read this and for staying informed. Your health is your most valuable asset.